Đây chút. Hạ điện thoại xuống tí. Xong chắc hai cha con cầm bánh kem vô trước đi, rồi cái mẹ tranh thủ mẹ xong mẹ vô sau vậy. Để mà công mấy anh chị chờ. Dưới đây nó các bạn, nhớ đừng có để xa quá nha. Rồi còn mớ đồ ăn quên sớm giờ cho Kim ăn cơm cha, chứ vô đó cũng ăn lung tung, nó ăn. Hai cá luôn hả? Liên qua nhìn chị tí xíu nè. Ba đang bận quay cho mẹ. Nghiêng qua tí lại đi đó.
Hi YouTube family, thank you for joining us today. This video that you are about to see is an older video that we had of Daryl, so we hope that you will enjoy it. Thank you so much for watching it and for your support. The area that I'm working on here is the eyebrows, and he has a couple of lesions that I'm just double checking and just doing some extractions on and cleaning up well.
Double check. Like I said earlier, you're gonna feel a little pinch, okay?
Mm-hmm.
All right, thank you, Daryl. Just a tiny bit right there. He's very oily, and so we may be seeing Daryl for a little bit, which I know everybody will enjoy that. I'm going to move on this side. And you can see as I stretch out, it comes out without even me pulling inward. Just me doing like this, it starts to come out. It's just a light hair, but see, I don't know if you could see it was coiled. It's very light, thin hair, but it was coiled in here. See it coming out? Okay, there was another. That's another one in there. Let's see. Okay. Move on down here. Let's see, we got a couple here. So you, as viewers, you've seen me clean Daryl's skin And I think it's been like maybe 3 weeks since we've seen them, and blackheads really oxidize pretty quickly. Okay. Okay, and then you could see that in that pore, there's hair that starts to, you can see it, pull up. Try to grab it. Don't. Just doesn't want to come out. There we go. Okay. Okay, there's another one here that we're gonna just work on a little bit. Nothing's not much in there, but yeah, so it's cleaned out that one. A little pressure, Daryl, okay? And then you can see the blackheads in here, so I'm going to go ahead and get those out. They look like little freckles. Even though you have little freckles, Daryl, you know that, right?
Never noticed it.
No, yeah, you got a couple little freckles. Okay, we'll stretch in here and okay, I'm going to go on this side here. Make sure it's clean. Alright, so now I'm going to go and work on this area where the filament is at. And Oh, it's not as bad. Okay, I'm gonna work on this area, and you can see there's some little pockets there that are filled. Okay, so he's got little, is this there? Oh, Daryl, sorry. You okay?
Mm-hmm.
Okay, made you wink.
Mm-hmm.
So let's see. Okay, now this one's a flesh mole. This one next to it, it's not. You okay, Daryl?
Mhm.
Can you breathe?
Mm-hmm.
I'm so glad. I'll make sure that, okay. And we still have a little bit more to drain out. I don't know if the camera caught that, but you can see all the buildup underneath it.
All right, so this is a new patient that we have here at our center. Her name is Paris, which I love her name. She's 22 years old, and she came in complaints with acne. And as you can see, she's got a lot of filament and some cystic activity and some blackheads, and we're just going to start cleaning her skin. She is already prepping her skin at home, and I'm going to start with some of the blackheads and start removing those. And what I'm just doing is just basically opening up the pores. Paris, thank you so much for allowing us to do this. And I promise we're going to take very good care of you. All right. You're going to feel a little bit of pressure, Paris, okay? First time you have this done, it's a little bit uncomfortable, but once you get used to it, I think you'll do great, okay? Again, it's just some pressure. I'm going to go back and open these up again a little bit more for her. Okay, I'm going to just put a little bit of pressure in there. And here. Okay. How are you doing, Paris?
Good.
Awesome. Again, just at the base till it's completely out. Got a little pressure in there. Going right at that base. Can you breathe okay, Paris?
Mm-hmm.
Okay, good. Okay, again at that base. There we go. Go over it again just to make sure it's all cleaned out, and it is. Okay. I really just want to concentrate today on the blackheads because it's the first time with us, and I don't want to work with any of the cyst activity right now. So until she kind of gets used to us and. And I'm going to go ahead and go back and open this again. Right before we started, I did wash her skin with the 20% glycolic wash. And again, that just works very nicely to pre-soften those pores. Makes the skin more receptive to us doing the extractions. How are we holding up? Little pressure?
Mm-hmm.
Okay, all right. And as you can see, it's already smoothing out.
a lot clearer. And you're going to see that all the pore sizes are also going to change for her, which that makes me very excited for Paris. Go ahead and go through here and work in some of these areas. Okay. Okay, Paris, I'm going to put a little bit of pressure.
Mm-hmm.
All right, so I'm going to start like right through here. I'm going to walk you through this, okay, sweetie? Here we go. Yeah, a little hard there. Okay. Let's move on because I don't, like I said, really don't want to. I want her to get the best treatment and the best results, and I just do not want to overstress her today. So I'm going to go through here. I'm going to go in this area and just get some of these blackheads through here. Now, Paris, I will tell you this area through here is a very sensitive area. A lot of nerve endings, okay? But you do have some blackheads that I do want to extract. I promise I will walk you through this. And soon, your body right now doesn't know what's happening. So it's going through this, what's going on. And so all of your nerve endings are in alert, okay? But I'm telling you, I've been doing this for many, many years. After a while, it's going to be a breeze, okay? Let's see if we can do this. Here we go. Was that a little better, Paris?
Mm-hmm.
Great. Okay. I'm going to stretch the skin so hopefully it's not as much pressure. There we go, right there. And it's out. Right in here the same way. I'm going to stretch out and I'm going to go inward. There we go. Go ahead and breathe out. Okay, Paris, here we go. Okay, I'm going to stretch here, and I'm going to tell you, I'm going to go ahead and extract now, okay? Here we go. There we go. How was that? Not too bad?
Mm-mm.
Great. Okay, she's got another one right here. Okay, Paris, you're ready. I'm going to stretch out. Here we go. And it's out. How was that?
Not bad.
All right. Okay. All right, Paris, I'm going to take you this way. And as you can see through here, she's got some. There we go. turn you in just a little bit this way. Okay. There we go. All right, we're going to go ahead and open these up for her too. Okay, so she's a little bit inflamed in there, so we're going to leave that alone. Paris had gone to see a derm in the past, and all she's gotten, or doctors, all she's gotten is just topicals at this point. So I'm really looking forward to managing her skin, and I'm hoping that she can tolerate it enough that she will hang in there with us, because we'll definitely want to walk her through this. And we'll love to be able to get the results that she's been really wanting to get. So, okay. I'm going to work on this a little bit. I'm just really trying to be really gentle with her. There we go. Through here. You okay? Mm-hmm. All right. Okay, so I think this is as much as I really want to work on Paris. Again, I really want to be mindful of our patients, and I want to make sure that they have the best care. And so thank you so much for tuning in with us. I can't wait for you guys to see her next time. She's going to look so much smoother, because she's going to be using the cleanser, and we'll get her in to do some more extractions, and she'll start acclimating to us doing the treatments here at our center. Thank you for joining us. Don't forget to subscribe to our Facebook page, and don't forget to tell your friends all about us, and we'll see you next time. So excited about having Daryl back with us, and we're going to be doing just like a follow-up with him, basically going over his skin, and if there's anything that's filled up again, we're going to go back and redo. But as you could see, his skin is done very well, color, pore size, but there's a little bit of areas that we need to go back and clean, and so we're going to go ahead and start. I think I'm going to start with the nose, so we'll start with that. So would you tell our audience how you're doing?
I'm doing fine. Everything is going to plan.
All right. Can you tell them a little bit of update on your travels?
In July, the end of July, we head back to Iowa, and we will be getting back on the kidney list.
All right.
They just want to see us
Awesome.
to make sure that I'm still living.
Yes, yes you are. You're alive and well. Good.
So what does that mean when you're saying a kidney list?
It's through the VA, and so I'll be going there to get tests done to make sure that they can match me and make sure that they can that I'll be a good candidate for the list. And that consists of lab work and some like a stress test.
Okay.
Mm-hmm.
Super. This area, it does get filled up pretty quickly. And so oxidizes pretty fast, especially if you're oily. So it has some filament through here and then some blackheads in here. Nothing like he had before, but it has filled up. Do we prime and prep the skin, or do we wash the skin before we do any treatments? Yes, we do. It's just that we want to make sure we record more of the extractions. I've also had viewers say, oh, I like to see more of you probing. Then I've had viewers say, no, don't do probing. So I'll kind of mix it up so that way everyone's happy. Does the Q-tip help to extract everything out? It really does. I know I had another viewer ask that, and like they felt like not everything was emptied out, but it is. Daryl, you're doing okay?
Mm-hmm.
Great. Can you breathe okay?
Mm-hmm.
Okay. Better make sure. I had one of our viewers that wrote, and I wish that I could remember the name, but I thought it was so funny. So I think he wrote, it's all about the base, and I thought that was really cute because it is going on the rim, on the base of that pore to pull everything up and out. So that was really cute. I laughed. Okay. So he always gets a pore here that gets filled, and until that sac is removed, of course, it's always going to get
refilled. At this point, the physicians are not going to do that. And so we're just going to go ahead and empty it out for them. How are you holding up?
I'm good.
Awesome. So I feel a little bit in here, so go ahead and make sure I clean it up really good. I don't know why I'm talking so low, but I'm gonna talk a little louder so you guys can hear me. Looks like maybe this is all. I got it all out. Feel this just a little bit, okay? How are you doing?
I'm good.
Might be a little sensitive. Okay, so he's got some scar tissue here, and we're just opening those pores to get whatever is built up underneath there. Okay. Go through here and check and see. It's doing really good. Let's go through here. It's got a little bit of Okay, so I'm almost finishing up on this take. I hadn't talked much. I got so inspired by just cleaning. Hadn't said much, but thank you so much for joining us and subscribing and supporting Daryl. And we look forward to seeing you on our next video. Don't forget to, if you haven't visited our Facebook page, please do. And hit like and follow us there. Also, we're on Instagram, so look us up there too. Again, thank you so much. And
It's morning, of course, it's when we're recording here, but I have Leslie with us, and so I'm really going to be doing some extractions again on the areas that are still healing up. She's doing absolutely fabulous. I'm going to go ahead and probe a little bit here. I went ahead and washed her with a 20% acid wash and dermaplaned her. So here we go. So I'm actually going in and just extracting those areas that have small little microcomedones. I'm going to go ahead and get those out because microcomedones grow up to be big comedones. And making sure that all those pores are cleaned out completely. Turn her a little bit this way. How are you holding up, sweetie?
good.
All right. I'm going to work on this area here. Now bevel up. I'm going to stretch that skin. Go right into that opening. And of course it already started to release. I'm going to push out. And then I'm going to clean this out for him. Okay? Scooping from the bottom up. Okay. Put a little bit of pressure there. Okay, I'm going to stretch and bevel up about 35-degree angle. Just lightly go ahead and open that area for her. Leslie, you may feel that a little bit, okay, sweetheart? But we're going to try to be as gentle as possible. Try to dry that up. Okay. What the trichloric acid, or it's called TCA, does is that it stops a lot of that purple. It penetrates and it breaks up a lot of the bacteria also. It's a great exfoliator. It's a healing agent. Okay, I'm going to stretch here a little bit. Push that out. If we don't clean these out, they'll get bigger, so we don't want that. Go ahead and start removing those.
Okay, stretch again. Okay. How are you holding up?
Good.
Awesome. Go in here and clean that out. And here we go. Stretch out and then go from underneath. This area is very sensitive and lots of nerve endings. Okay, I'm gonna go in through here, the nose area, and see what we can find. Okay, here we go, Leslie. Ready? Okay. That's a really sensitive little corner, Leslie. You're doing great. Make sure that the bevel is up. Okay, here we go. And it's all out. Okay, again, we're going to go through here, and you can see they're pretty receptive. Okay, stretch this area out. Kind of scoop everything. Same with this area through here. It's a little uncomfortable. She's got a lot of little blackheads through here, so we'll make sure we get those out. Thanks, Leslie. And here we go again. And get those blackheads out through there. Same here. Thanks again, Leslie. Let me go ahead and just got a little bit more through here. I want to go ahead and clean this area out really good for her. So here's one. Okay. And then through here, I want to make sure that's clean too. I don't know if you'll be able to see it with my gloves, but I go through this corner here. Okay, I'm gonna push. You breathing okay, Leslie? Make sure. There we go. Okay, there we go. Some more here. She went on vacation. There we go. This corner here. There we go. It's funny, I can honestly say that I can dish this out, but I'm telling you, when it comes to me getting extraction, I am the biggest chicken. I don't let anybody extract my skin. So anyway, that's why I really just, if it's too much, you let me know, okay? All right, looking nice and smooth. There's some little areas through here and I want to go ahead and get out, and you can see it. If you been watching my videos, you know that the longer they stay, they just keep growing and the pores get bigger, and so we want to try to get them out as much as we can. All right, so we're done with this half. I'm going to go ahead and move on down. Now, she does have Amelia here that I want to go ahead and get out for her. Aren't you excited? So let's see. I promise this, I don't think it's going to bother you any, but let's see. Okay? So you want to just probably keep your eye closed. So I'm going to put some, pressure, but you're going to hold your eye closed, okay? So what I want to do is go ahead and go at that base and just open it up, okay? There we go. And then we're gonna go ahead and keep that eye closed for me. Go through the bottom and just start getting it out, and there it is. It's out. Now I'm going to double check because I see a little bit more in there. So I'm going to go ahead and stretch and go through the bottom and just kind of wiggle it out a little bit. Sometimes it gets, attached to that area of the skin, and we just have to work it out, but it looks like it's gone. Okay. Clean. All right, let's go ahead and I'm going to go ahead and move through here. And I want to thank you so much for joining us today. Truly appreciate you following us and supporting Leslie. Thank you for your wonderful and beautiful comments. So appreciate it. And we look forward to seeing you next time. Don't forget to look us up on Facebook under Anilsa Skin Essentials /Acne Clinic, and hit like and follow us there too. All right. Have a wonderful and blessed day. Look forward to seeing you next time.